All right. Hello, my name is Brenda Stoudemire, and I just wanted to address some of the slides that were presented to the Peshtigo Water and Sewer Board on Tuesday, November 12th at their meeting. So this is probably more for the health department to kind of educate them on some of their talking points that are from 20 years ago or whatever. So Molly Bonjean, I don't know how you say it, but we had Dr. Grandjean as an expert in our fluoride lawsuit. He's the one that has conducted a lot of the PFAS research, and EPA has used his findings for setting the PFAS standards in the United States. He has also conducted a lot of the fluoride research as well, and he was one of our experts. So it was pronounced Grandjean, so I assume it's Molly Bonjean, but I could be wrong. So community water fluoridation was the presentation that was handed out. I just want to, cover some of the things like fluoride is a mineral that occurs naturally in soil and water. Yes, it is, just like asbestos is a mineral as well. Just because it naturally occurs does not mean it is healthy or good or safe. Mercury and lead are also naturally occurring in the earth. Also, in this presentation, it says, fluoride can prevent tooth decay across the lifespan. Both children and adults benefit from that. We don't really know if fluoride is beneficial to adults. There hasn't been very much high quality research done on this. Cochrane did an evaluation of water fluoridation back in 2015, and again, they published their findings in 2024 as well. And in both of those reviews, they could not find any high quality evidence it benefits adults. And as you know, the 2024 publication found that it reduces tooth decay 3 or 4% to maybe nothing at all. The health department has also been using this graphic of this little muscle tooth. So back in the 1940s, up until around, I think it was 2001-ish, the government and dental promoters believed fluoride worked in the developing tooth to build a strong little muscle tooth. We know that's not how it works. It's, in 2001, CDC understood that it worked topically, not systemically. This was covered in our sworn deposition with CDC, with their representative, and they agree. We used to think fluoride worked like this by building strong teeth below the gums. Now we know it works topically after the tooth has erupted in the mouth. So I stop using that graphic. It makes you look stupid to anybody who has looked at the evidence of it, building strong teeth. It doesn't work like that. Also, there's a slide on how many kids have untreated tooth decay in Wisconsin. About 1/5 of Head Start and third graders have untreated tooth decay. 3/5 of third grade children have experienced tooth decay. Half of Head Start children have experienced tooth decay by the age of 5 in Marinette County. According to Northern Lakes, between 2022 and 2023 dental outreach program, about 55% of the approximately 1,500 students seen across 8 school districts and 1 private school either currently had at least one cavity or at least one cavity treated in the past. So despite 79 years of water fluoridation, we still have tooth decay as the number one chronic disease amongst children and adults because fluoride does not help this issue. Diet is a huge factor, vitamin D deficiency, and access to dental care is more important than fluoride. another slide has the Wisconsin DHS supports the recommendation of 0.7 milligrams per liter of fluoride in drinking water. So you can control the concentration that's in the water of 0.7, but you cannot control the dose that people are getting, especially pregnant women, which has been identified as the critical window of harm in our litigation. So experts testified in court that during fetal development and in the first 6 months of life, when infants and fetuses have no teeth erupted in their mouth, this is when the impacts of the brain are seen or occur. And so pregnant women who drink 2 liters of water per day receive about 1.4 milligrams of fluoride per day. And, that is concerning because 1.5 milligrams per liter has been the level in women's urine that is concerning for neurotoxicity. So pregnant women tend to drink more water during pregnancy. And also a critical thing that came up in our litigation was that during the 3rd trimester, women's bones will release fluoride because that is the trimester where an infant's bones are developing. So any fluoride that's been accumulated in the bones will be released. And so women have a much higher fluoride level in their blood and urine during this time because of that. So, the health department, it would be wise to monitor the public's urine, blood, saliva, hair, nails, anything, just to see what the baseline is before you cry that, all the poor kids need this neurotoxic substance added to their drinking water supply. Let's see. There's another slide on how, it saves money. When you add fluoride to water, they say that you can save an average of $32 per person in dental care for cavities. That is a very over-exaggerated talking point. If you take into account dental fluorosis, which over 70% of our adolescents now have dental fluorosis or tooth damage on at least 2 of their teeth. It looks like little white spots on the teeth. If you take that into account, it makes any dental benefit financially zero for the estimates. And if you take neurotoxicity into account with this overinflated estimate, you will find that fluoride actually costs us billions of dollars annually in IQ loss in the United States. So it's clever that you guys came up with this, but you're not accounting for a lot of things in that over-exaggerated monetary benefit. You're not including spills. Sun Prairie, Wisconsin last year, their check valve didn't work, or their check ball, whatever, didn't work, and all the fluoride was siphoned into their water tower. They had to dump that water tower multiple times to try to flush out that water. So, when accidents like that occur, it's not incorporated into this overinflated estimate. And also dental fluorosis is not taken into account, or the IQ loss. Let's see. This presentation also goes over, how the poverty rate in Peshtigo is around 9.8%, I believe. And that fluoride, reduces the cost savings there as well. In 2024's Cochrane publication, they addressed this, and they found insufficient evidence to determine whether water fluoridation results in disparities in caries according to socioeconomic status. So once again, there isn't really any benefit to poor people that Cochrane could find, and I doubt you could actually find any benefit as well if you look at the literature and not just parrot these, manufactured talking points and marketing materials crafted by Matt Jacobs and others who are paid very substantially well to create talking points for you. Your PowerPoint also talks about the NTP program study. And, it says things like, remember, association does not equal causation. The IQ and exposure to high levels of fluoride means that both were found at the same time, but it does not mean that lower IQ levels are caused by exposure to fluoride. There's a bunch of, word smithing that went around in this. The authors of the NTP report state in 2023, I believe it was, they state, quote, several of the highest quality studies showing lower IQs in children were done in optimally fluoridated 0.7 milligram per liter areas in Canada, yada, yada, yada. So, Health and Human Services keep saying, well, they didn't say that this is applicable to water fluoridation when, if you ask the authors, it does concern fluoridated water because we're not just getting 0.7 from the drinking water. We're getting from our dental products. If we drink a lot of tea, if we eat certain foods like grapes have high levels of fluoride on them because fluoride is a pesticide often used and it accumulates in foods. Tea naturally absorbs fluoride from the environment, so has naturally occurring high levels of fluoride. So it also talks about, all the different studies that have been done in other countries, which it's kind of shocking, don't you think, that there's never been any cognitive studies on the brain in the United States. There was a study conducted and published in early 2024. It didn't make the deadline for the NTP report, but it did find, it was done in California, found fluoride increased anxiety in kids, autism-like symptoms, and other things. So, the studies are being conducted in the United States now. They're not showing that fluoride is safe or healthy, especially for the brain. And there is an IQ study that should be published sometime this fall. I thought it was going to be published in the spring, but as you can see, there's a huge dental interest, and these dentists are very powerful. The Wisconsin Dental Association, the American Dental Association, the Fluoride, what is it called? The Fluoride Society that Johnny Johnson runs, the American Fluoridation Society, or whatever it's called. They are very powerful and do a lot of lobbying, and they work very hard to try to block these studies from being done. The Wisconsin State Dental Director worked very hard to have complaints put on the NIH scientists, specifically the ones that conducted the Green et al. Paper, finding, 0.7 lowers IQ in our children, and it was done in Canada. The Wisconsin State Dental Director, Russell Dunkel, worked to file complaints on those researchers. The complaints were thrown out by their universities and the U.S. government because it was more of just a slanderous attempt to ruin these researchers' careers and to block them from getting further funding. And it caused, one of the particular labs to freeze any research while this investigation was being done, which harmed their, funding and ability to work in their lab. So I believe there will be more litigation coming out in the future. So, the NIH, the National Institutes of Health of the United States, has conducted some very high quality fluoride research now in Canada and Mexico. And they all find that levels of 0.7 milligrams per liter impacts the brain in a negative way. And as I said, we're waiting on the U.S. government, the U.S. IQ study that was done in California. And I believe there was another one or two done with different cohorts from around the United States as well. So We don't think those will be released this year, but it's coming. And, there is no putting the genie back in the bottle. Fluoride impacts the brain. Everybody agrees fluoride has the ability to negatively harm the brain. Everybody agrees that it is a neurotoxin. Everybody at EPA, CDC, etc. So it's not if, it's when fluoride's going to be stopped for the United States. And, this PowerPoint also says again, the findings of the NTP monograph should not be used to draw conclusions about community water fluoridation. That is a common talking point that fluoride promoters are using. And as I said earlier, NTP has addressed this in their monograph in the comments from 2023 when that came out. And just a reminder of what they actually say is that several of the highest quality studies showing lower IQ in children were done in optimally fluoridated. I just lost it. Sorry about that. I just want to make sure that I am precise with what I am telling you because I do not want to give you the wrong information. I want you to learn something from this because we're all moms that give a shit about our kids and other people's kids. So several of the highest quality studies showing lower IQs in children were done in optimally fluoridated 0.7 milligrams per liter areas in Canada, but the individual exposure information in those studies, as documented by repeated urinary measurements, suggests widely varying total fluoride exposure from drinking water combined with exposures from other sources. For example, many urinary fluoride measurements exceed those that would be expected from consuming water that contains fluoride at 1.5 milligrams per liter. And this was an NTP reply to Health and Human Services comment, and it was published March 15th, 2023. All right, so, other frequently asked questions. Is fluoride still needed? Yes, it's critically important. Tooth decay is widespread, affecting more than 90% of Americans by the time they reach adulthood. In my opinion, it's because nutrition and diet isn't being addressed, and we're throwing fluoride at a problem, and it's not a fluoride problem. It's not a fluoride deficiency problem. It's a nutritional deficiency problem, a vitamin D deficiency problem. Adding fluoride to water. It's like adjusting, vitamin D added to milk to prevent the disease of rickets. Iodine added to salt to prevent goiter, which affects the thyroid gland, or folic acid added to many breads and cereals to strengthen health of red blood cells. So, we add fluoride to all these products. I don't buy bread with folic acid in it. When I was pregnant, I didn't take folic acid for my child. I took folate. I found the naturally occurring substance, not the artificial. I didn't want the artificial because I read some studies that it was linked to asthma. So, I like to do my research and my homework. So vitamin D, it's needed for the human body. Even tooth decay can be prevented or reduced with vitamin D if you have your optimal vitamin D levels. I took biochem. My ex-boyfriend, he majored before med school. He majored in biochem as well and microbiology. So, he learned biochem, and I remember when he was going through majoring at UW-Madison in biochem, and I took my own biochem class, through college because I wanted to know how fluoride affected, enzymes and what its use for was in the human body. There is no biological function in the human body that requires fluorine or fluoride. It is a poison. It is it's an enzyme poison, actually. Vitamin D is needed. Fluoride is not. Folic acid, I would say folate is needed. I wouldn't take folic acid for myself. Iodine is needed for the thyroid, stuff like that. Fluoride is not it's not used and needed in the body. My teeth, I want made up of hydroxyapatite because it's more flexible. Fluoride does make teeth harder. I took a metallurgy class in college. I went to school for environmental engineering, so I have an interest in elements and stuff like that. So we learned that when you make a substance harder in metallurgy, you also make it more brittle. I don't want brittle teeth. I don't want teeth that are going to be more prone to cracking and needing crowns and stuff like that later on. I want my teeth made up of hydroxyapatite. That's the kind of toothpaste I buy. I have met many dentists who have gotten away from fluoride and they use hydroxyapatite in their clinic as well. So, people can choose to buy fortified foods, but when you're adding fluoride to the drinking water, people can't choose to opt out of that. Or, if they choose to opt out, it costs them a lot of money to buy, non-fluoridated water or water filtration systems. And it's very expensive to maintain the water filtration systems, especially if you're low income. I was a low income mom when I had my kids before I started working in the water industry in Wisconsin, when I was going to college and stuff like that. And it was really hard to protect my kids from tooth decay because I was constantly being given, WIC would give me juicy juice and cereals. And I was like, I don't want my kids to have this stuff because I don't want to give them tooth decay. I can't fight fluoride and have kids with a mouthful of cavities. So, I learned about Weston Price, the dentist from the early 1900s that went around and studied all the people's teeth in the world and how there were cultures who never brushed and flossed and they had excellent dental health. They had nice bone structure. The women didn't have problems birthing their babies. So I just followed the Weston Price stuff for my kids. I ordered cookbooks that were based on Weston Price stuff. I gave my kids a lot of bone broths and stuff like that. It was really hard to do as a low-income mom, but I did it. If I did it, anybody can do it. And it was hard, when you're constantly being bombarded with junk food. My kids would bring home bags of food, around holidays and stuff from the school, and I would have to go through and basically chuck it away or donate it because most of the freebies is junk that is going to promote tooth decay, not protect against it. There's also a slide on other frequently asked questions. It says between 2000 and 2008, an additional 34 million Americans gained access to fluoridated drinking water. This is outdated. Between 2020 to 2022, CDC, Community Water Services that adjusted the fluoride in the U.S., it dropped from 5,728 down to 5,561 utilities. It also, goes to say, is fluoride in drinking water safe? Yes. Over the past several decades, hundreds of studies have confirmed the safety of fluoride. More than 3,000 studies or research papers have been published on the subject of fluoridation, meaning few topics have been as thoroughly researched as fluoride. We deposed CDC, EPA, FDA, the chemical companies, and NSF, and they all, each one, found 0 studies finding fluoride is safe for the brain. So that 3,000 studies, I think that's over-exaggerated, and EPA, CDC, FDA couldn't find any. So let's see. It also says, according to EPA, while the decision finds a risk sufficient to trigger regulation under the Toxic Substances Control Act, it is important to note that the court does not conclude with certainty that fluoridated water is injurious to public health. You forgot the rest of the sentence. The rest of the sentence says, rather as required by the amended TSCA, the court finds there is an unreasonable risk of such injury, a risk sufficient to require the EPA to engage in a regulatory response. So we anticipate EPA is going to create a new MCL, maximum contaminant level, for fluoride. And when they do that, they will have to put out a public comment period for comments. And I'm sure, the Fluoride Rapid Response Team will have their cartel submit many favorable talking points on fluoride. But we know 1.5 milligrams per liter is neurotoxic to the brain. EPA uses a safety factor or uncertainty factor typically for neurotoxic substances, and that is typically a factor of 10, meaning 0.15 will be the safe level of fluoride for the brain. And EPA currently has an MCL of 4 milligrams per liter. And if you include that safety factor in that, it would make 0.4 milligrams per liter the safe level based on our current MCL. And, it's interesting that EPA has kind of turned a blind eye to fluoride. As you probably know, in 2006, the National Research Council, which is part of the National Academies of Sciences, did a review on water fluoridation, and they found it was too high. The MCL of 4 and the MCL goal of 2 are too high. They were based on crippling skeletal fluorosis back in the 80s and 90s, I believe. And EPA scientists said, this level is going to create teeth that makes kids look like they were chewing shoe polish, and it's ugly enough to gag a maggot with those teeth. So EPA set their MCL of 4 milligrams per liter based on crippling skeletal fluorosis, but now when they take the impacts of the brain into consideration, this should end water fluoridation. But as you've seen today, the amount of people interested in protecting fluoride and denying the science is very high numbers, and this has delayed the action of fluoride being known as harmful to the population, but it's only a matter of time. Like I said, it's not if, it's when. And EPA is slow to act. We've been following PFAS. I got rid of my PFAS cookware, my Teflon cookware back in 2003, 2004-ish. Now it's 2024, and now we know that that's harmful. I've, always been a little bit ahead on the curve. I have one of my best friends is a medical doctor, and she always jokes, she remembers 22 years ago that I was warning on something, and now it's it just comes out that this thing is harmful, and she always laughs and sends me something, or she's always texting me something that, you knew about this 20 years ago, and now you're validated. So just like fluoride, I don't make any money off of fluoride. I don't make any money for any of this. I've actually spent a lot of money out of my pocket and fundraised a lot for our court case. So I don't have any skin in the game, as the Dental Association said, or the Russell Dunkel, I believe, from the Wisconsin Oral Health Department. Russell has taught at Marquette and some of the dental hygienists at tech schools, so you can kind of know where the little foot soldiers are getting their talking points, and it stems from Russell Dunkel, and then they have a lot of their talking points crafted from Matt Jacobs, who is a paid private consultant, and the ASTDD is who pays him. They are all of the dental directors in the country, and Russell Dunkel, DHS Oral Health Director, is the president of ASTDD. And we did get to depose the last ASTD president, and she admitted under oath that the complaint letter that they sent out to the government and to the labs that were conducting the NIH funded neurotoxicity research, she didn't read the letter before sending it out. She just signed her name to that letter that basically was slanderous to these scientists and their reputation. And so, fluoride is very interesting, and I love to share my knowledge on it. I know, Molly Bonjean did not want to hear about my vitamin D stuff at the end of the meeting. Um, I want open communication. Like, I think I have some very valuable information to share if people are open to it. But if you're going to be stubborn and think, fluoride is the magical bullet that we've been promoted, it's not. Tooth decay remains the number one chronic disease in both adults and children, even after 79 years of fluoridation. And in fact, over 70% of our kids have the white spots or tooth damage on their teeth from the fluoride damage. And there are studies that indicate that this fluorosis is an indication that the brain has been damaged as well. But once again, those studies were conducted in other countries, which should not be a defense that, fluoride is safe because all those studies were done in other countries. That means, whoa, why haven't we done the studies in this country? And it's because, of political and other reasons, not because we didn't have the money or didn't want to. It's more that we didn't want to know. And now we're starting to know. And more scientists are curious, and more funding is coming forward for fluoridation and how it affects the thyroid and lowers thyroid activity. We've known since the early 1940s that fluoride suppressed thyroid activity. It was used in some countries for hyperthyroidism. They would prescribe fluoride tablets. And just to note, those fluoride supplements that Molly wanted for her child that was suffering lots of tooth decay, they've never been FDA approved. They've never gone through safety and effectiveness research, even though they are on the market and they need to be gotten by a prescription. So if you have any questions, please do not hesitate to ask. I have a website called fluoridelawsuit.com. If you go to the fluoridelawsuit.com/science page, I have archived all of my favorite studies with my analyst, Karen Spencer, and we provide that for people who are curious about the research and want to see what has been published since 2015, when the optimal level of fluoride of 0.1 to 1.2 was dropped down to 0.7. We have been archiving that for people to make it easier. And if you need anything, let me know. Thank you very much. Have a great day and rest of your week. And I hope you all learn a little bit about fluoride, which is fluorine is my favorite element on the periodic table. And so I'll see you soon. Thanks.